everyone. My name is Gabbie, and I'm with Castle. And as you know, September is National Sickle Cell Awareness Month, and I'm here today with 18-year-old Cornell Brown, and he's here basically to enlighten us and give us information on sickle cell and his journey with sickle cell. So, hello, Cornell. How are you? I want to first start off by saying thank you for sitting down with us and having this conversation with us, because it is absolutely important for people to know what sickle cell is and how to get tested and where they can go for advice, and just to hear somebody else's story as encouragement. So I want to start off by asking when you were first diagnosed with sickle cell.
I was 3 months old. Mom didn't know why I wouldn't stop crying as a baby, so she finally took me into the emergency room. The doctor asked her, "Do you know if he has sickle cell now?" She said, "No, I do not know. My father had it, but she wasn't sure if I had it." Okay. The doctor tested for it, and he said, "Yes, he has sickle cell. He has SS."
Okay. So can you tell me, I know there are different types of sickle cell. Can you explain what's the difference between?
Well, SS is like the really bad type. It's like constantly pain, going in and out of emergency rooms. SC is like you may get admitted maybe once or twice every 3 months, maybe even 4, depending on code.
So when you have a crisis, can you explain how that is?
It depends. Some people, it'll be a stabbing pain or just a muscle ache pain or a throbbing pain. But it can be anywhere to your legs, your head, back, arms, anywhere.
So how do you know, is the pain that bad when you have a crisis that you know that you're going through a crisis, or does it start small and gradually get worse?
Well, sometimes it will start out small and then get worse, or it can hit you really hard, like out of nowhere, and you just in pain, can't move, don't want to talk, just curl up into a ball.
Okay, what would you say is your first memory of really knowing you had sickle cell when you were young?
I would say around 5. I had really bad knee pain and I could not walk at all. My mom had to take me to the emergency room and they had to admit me for 2 weeks, giving me nothing but morphine to ease the pain.
So, is morphine something you get every time you go to the emergency room?
Yes, 50-50 chance when a sickle patient goes into the emergency room, they're going to give them morphine for pain. I'm not a big fan of it, but it helps sometimes.
So when you say sometimes, there'll be times when you do get morphine and it doesn't help?
Yeah, sometimes they have to raise the dose higher and higher.
And how does that affect your body?
Bad. You get drowsy. I get migraines if I be on it for too long. It makes you constipated and makes you just not alert and aware like you would be.
So when you do go in, how long do you usually stay?
Sometimes 3 weeks, almost a month.
Oh, wow. What's the longest you've been in the hospital?
3 months.
3 months. And that was just for a crisis, or?
Crisis, and then it ended up turning into surgery.
And what kind of surgery was that?
It was knee surgery.
Knee surgery. Okay. Have you had any other surgery?
Yes, I had 4 on my neck and 1 on my hip.
Tell me how it feels, or how you feel, or how you prepare when you're going into the hospital, or when you know you have to have a surgery.
Normally, I just stay calm, and I always have a backpack just in case. Like I said, SS, you constantly going in and out. The hospital kind of becomes a second home for a sickle patient. So during the surgery times, I had good doctors. I never was nervous. I stayed calm, trusted them. I had to stay calm so my mom can stay calm.
So how does your sickle cell affect your family?
It affected my mom a lot because constantly she had to try to balance out the working time and how to come home, take care of my brothers and sisters, and then come visit me at the hospital. It was pretty hard for her.
And what about your siblings?
They did not like it at all. Some of them couldn't bear to see me when I was in isolation or when I was in ICU. It just tore them up.
So does anybody else in your family have sickle cell?
Yes, my little cousin. Right now, he's in the hospital he has a little lung problem, pneumonia. They think it is. So he's been in there for a week, 8 days, and been constantly pain. They just gave him morphine, 30 milligrams, and his mom not liking that neither.
So, tell me, what is your medication schedule like? Do you have to take medicine every day, or do you just take it when you're in pain, or how does that work?
Well, that depends on how a sickle patient is. Some of us, we either get transfusions once a month for our hemoglobin to stay at a good rate so we won't have a sickle crisis. And some of us who hemoglobin is good, they put us on this thing called droxyl. It's a medicine that keeps our hemoglobin at a good level so we won't have a crisis.
And so you do that every day?
Yeah, that's an everyday medicine.
Okay. How do you feel on your worst days?
Well, terrible. Like, don't bother me. Just please leave me alone. Just don't want to be bothered. That goes for all sickle patients. I mean, you may think, no, that's not mine, but when they're in a really bad pain crisis, they do not want to be bothered.
So, how did it affect you when you were younger? Like, did you go to school, or did you go outside and play,
Well, it affected me hard. Like, I was young, and I was a little upset that I couldn't do what other kids could do, go out and play, have fun. I was constantly in and out of hospital. It set me back, too, even at a young age with school and my credit, so it was really tough.
So you're in school now?
I'm in school now.
And how is that for you?
It's going pretty good.
Okay.
We're keeping our fingers crossed during the winter that it'll stay good, because wintertime is,
It gets worse?
yes, it's not good for sickle patients.
Why is that?
For some reason, the cold and sickle in our body, it just starts to act crazy, and some people can tolerate it, some can't, but we all end up having pain crisis. Some years be better than the other ones, some years will be worse. We never know.
So what would you say is the most important, what do you say is the one thing you really want people to take from your experience in this interview?
In my experience, to know if you or anybody else have sickle cell or the sickle cell trait in your family, and if not, get tested. Because the last thing you want is to have a child that's in a lot of pain and you don't know what to do. You're panicking, and then your child just sit there in pain.
Okay. And my last question, what advice or what encouragement would you give to another sickle cell patient?
Another one? What I would tell them is don't be afraid. I mean, it could keep beating you down, but you're a warrior. You can always get back up. God's there on your side, and He has angels that help you too.
Well, thank you, Clavell, and that wraps up our interview.
You're welcome.